Okay, we're going to continue our discussion by shifting gears from a housing kind of thing or facilities kind of thing, and we're going to transition through mammary anatomy, mammary physiology into mastitis moving forward. So we get our pointer going here. So, mammary system of the cow. We think about modified skin gland. So these were primordially or embryologically, these are skin tissues, and we'll see that in the structure as we move through. Some people call them modified sweat glands. So milk as sweat is not something I really want to think about, but there is some similarities between a secretory tissue in the udder and the structure of a sweat gland. We know that the udder is not directly connected to the abdominal cavity. There's a kind of an umbilical cord that comes out through the body wall and supplies the things there. So it's not continuously open to the body. It sort of sits on the abdominal area and has things there. So with our dairy cow, we're talking about 4 mammary glands grouped to form the udder. Each of them is more or less separately supplied of blood to and from, and there's no real communication with the duct systems of all 4 quarters. They're maintained separately. So in theory, if you infuse something in one quarter, it's not going to come out another quarter unless it diffuses through the body. There's not a continuous connection. So whatever milk is produced in a quarter will only exit from that quarter. They do not have trans milk going from one quarter to another. The right and left halves are separated by the intermammary groove. We're going to show you some old pictures from a long time ago, really give you a feel for how that sits together. The udder weighs 25 to 60 or more pounds. We've got the suspensory system that holds it up, the blood system that supplies it. The rear quarters are larger than the fore quarters. We're usually looking at 25 to 50% more secretory tissue in the rear quarters than in the fore quarters. The support system, we've got a number of different elements that are coming together. Skin is going to support sort of the outside, but it's more for protection. There is a certain amount there that holds there. But what's really holding up the weight is the medial suspensory ligament. It's going to do most of the work. Comes down from the midline of the animal connected to the pelvis and radiates out into the udder, both fore and aft, and puts that all together. Lateral suspensory ligaments work in parallel with the medial, and they come in from the side and form sheets that go down and kind of cradle the secretory tissue. So here's a diagram. It's maybe not the best, most accurate, but we start to see the organization. We've got secretory ligaments coming through, big one coming down the center, and then we have the lateral ones coming in from the side. Again, sort of cradling the secretory tissue, holding it up. You've got the secretory tissue high up in the udder, and we have a number of small ducts that lead to bigger and bigger ducts until we get down here into the gland cistern, formerly I guess called the lactiferous sinus, gland cistern, teat cistern down here. We've got veins in the teat here, sphincter at the bottom, street canal moving through. I think this gives us a good look of how that medial suspensory ligament really holds things up. Again, it's not totally accurate. It's a representation, a little oversimplified. But you've got the big ligament coming through, or tendon. I guess it can't be really a tendon. It's not connected to a muscle per se. You got the suspensory ligament coming down, and you've got the laterals going out and then coming back in. The suspensory ligament in the middle is going to do most of the work. If you've ever had a cow that drops that suspensory ligament, we basically a break there, and everything kind of goes out, and the only thing holding up it is more or less the skin. Although sometimes we may have if the break is low enough, we may have some outside things. Generally, what happens is we have a splaying of the teats in either direction. Whole thing drops down, and you're milking one half of the side of one half of the cow at a time, doing the right side, and then walking around doing the left side. If you're in a tie stall situation, another kind of schematic. Again, central, medial, and the laterals coming around. What we're doing when we look at it from the side is these lines here are sheets that form the tissues there, and we'll get a diagram. This is a much better diagram here. Again, you got your medial suspensory ligament or your connection up here to the pelvis. Most of the weight here, but you've got the outside coming in. And what you're doing with these ligaments is layers of secretory tissue are held up, cradled as we get down more and more layers going through. You can see from this perspective, we're looking at sheets that come from that central connection area. B, the letters match going through. So this D here is this sheet on the outside, that whole kind of layer sheet that comes down and cradles the udder. Here's the article. You got this article up on Blackboard. You got the full article. I went through and pulled some of the pictures so we can talk about them. So this is from a long time ago. Can't remember off the top of my head. I think it's 1926. So what they did is they took this cow and said, "You're going to be our demo here." They have this cow, how she looked a month before she died. They uh, basically pumped all the blood out of her, so she's dead in this picture. And then they pumped plastic back into the veins and the arteries. So you've got supporting equipment with the ejecting tube into the jugular in position, and then once everything was hardened, they took all the support stuff off, and the cow, as embalmed with all that plastic uh, equipment, is more or less standing there rigid and so they went through. This is how the udder looked at. They took all the blood, or just before she died, and then we have the appearance after embalming. So we had a lot of empty space over here. They got filled up by that injection of that plastic material. What they started to do was to dissect the animal. They've got the animal supported there, and they slowly peeled layers off. They took the outer leg off, and they showed here the skin holding up the udder on the outside, but you can see through here that you've got kind of a separation, or it's kind of attached to the abdominal wall through there. So we've got things plugged up, we've got the udder. We're going to take off layer after layer to show you the supports that are associated with this udder. So we've got everything kind of there. The leg is missing. how everything kind of sits and puts in. You've got the abdominal wall here and your different sections of connection. So you can start to see over here how those um, lateral ligaments come together. Take both legs off. You can see that we're starting to get that shape we saw in the cartoon, that teardrop shape. Everything goes to the pelvis up here, the ligaments that support going through. So you've got these open spaces moving through. That you could sort of soft dissect the udder away. Your connection up here is where everything is kind of coming down. We're going through layer after layer. We're starting to get where we're focusing or having most of the ligaments exposed now. So you've got your lateral ligament here. I believe that's, double check that. Lateral layer for deeper dissection. You're starting to get into the arteries and veins that are there. There's a circle we'll get to in a minute. There's a circle of veins that sit on top of the marrow, showing some of the tissue and how things are layered out. So we're stripping more and more away. As you can see that the main support here is at that medial ligament that's going to go out and flower in a couple different directions, but everything else is removed, and this is pretty much holding the bulk of the weight. You can see an airspace through here where we're not directly, everything that comes down into the udder comes through this particular area and radiates out to hold everything. Getting in a little bit deeper, we're down to the very minimum here. That again is going to create that lateral and medial suspensory ligament. All that is showing how that more or less it's not continuous. You've got the abdominal muscles coming back. It's not. So arterial supply, we mentioned it in A and P, we'll mention it again. You're going to have the aorta coming back, and you're going to have things splitting off into a right and left side. The external pudendal is going to have a right and left one. That's going to split into the cranial branch and the caudal branch of the mammary gland. So if we have a right and left of number 6 here, and then each of those divides into a front and back, we have an artery servicing each of the quarters through. An overhead view, we've got to go into the track here. We're splitting off to the right side and the left side of, well, the mammary gland. There's a circle of veins sitting on the top of the mammary gland. So you have your medial suspensory ligament coming down from where your nose is to the udder, which sits underneath it. This vein or circle of veins is kind of sitting between the body cavity and the udder. And what you're going to have is with this, you're going to have two different places that the venous drainage can go to, either toward the front of the body, so subcutaneous abdominal vein, milk vein going forward, or it can come up the back side of the cow and join eventually the inferior vena cava. So superior, inferior. So you have an opportunity here with the valves, the check valves, that no matter how she's laying or where the pressure points are, venous blood can leave the udder. So if she's laying on her stomach, maybe it all comes out this way. She's putting pressure somewhere laying back. It can come out the front. She's walking. So we don't want a vacuum of blood in this, and this dual exit allows that. Again, it sits on the top of the udder between the cavity wall and the udder. Um, and allows more blood. The blood never gets backed up in the veins or by the veins, so we can get more blood through the artery and produce more milk. So if we look at the directions, we're going that way, we're coming in. If you look the way these things are, and then we lose the blood. So we can have the blood exiting either up into the inferior vena cava or to the superior vena cava, going around each way. If we look at the structure from top to bottom, most of the top part of the udder is the secretory tissue, and then we have the duct system taking up more and more of the volume as we get down to the gland cistern, and then the teat cistern moving through. Up in the top part of the udder, we have the alveoli. These are collections of lobes, and we'll talk about that. They drain into a common duct system. More and more ducts branch together. Eventually, you get down the mammary ducts to the gland cistern. We got the cercoid fold, teat cistern, Furstenberg's rosette at the top, and then the street canal leaving through the muscle, circular muscle down here. So organized into lobes and individual lobules, individual alveolus, the little circles here. See those individual alveoli in our drawing here. So these are surrounded by a basement membrane. So you've got the secretory tissue on the inside. Technically, on the outside of the body, milk is being formed in little droplets of fat in there. You got a basement membrane that the secretory tissue sits on, and then that's surrounded by the myoepithelial. You'll see in these um, muscles here, right here, underneath, and then the outside of that is the capillaries. So muscle here, that's going to help with our squeezing of the alveolus to eject the milk, and then the outer layer of capillary bed that supplies the um, alveolus with the nutrients it needs. Another close-up look. Again, we see the epithelial tissue on the inside that secretes the milk, sitting on a basement membrane, the myoepithelial, and then we have the blood supply sitting on the outside. So every alveolus has got its own capillary bed, and then the capillary bed drops off the nutrients, and then they're collected and head back, either going across the stomach or up through the abdomen and then thoracic cavities. So street canal, the exit in the teat is lined with epithelial cells. Furstenberg's rosette sits at the top. That's going to secrete keratin. These are long chain fatty acids that have bacterial static characteristics. That means they will stop the bacteria from growing or multiplying, but they won't kill it. So bacteria do get engulfed in that keratin. They're going to stop growing, which is a real plus. Removal of the keratin increases susceptibility to infection. That happens when we have a long intermammary infusion tip. We slide that through the street canal up to the Furstenberg's rosette, and we pretty much blow that keratin out. It takes 1 to 2 days to regenerate if removed. That's why we've gone to the short infusion tubes that only go halfway up the street canal, don't blow all the way through, so you leave that keratin intact. Around the street canal, we have a circular muscle that helps close down that sphincter after milking. We've got lots of blood and nerves that supply that teat end. We also have longitudinal muscle running the length of the teat, and we have skin on the outside.